We heard the HSE chief Paul Reid saying today that he feels we're at the entry of this particular surge, not the exit. Where do you think the numbers could go potentially?
I think they'll potentially double again. So we have seen a doubling in the last few weeks. I think we'll see a doubling again before it starts to plateau and starts to drop. And this surge will pass, but at the moment the risk of COVID in the community is very high. And the WHO advice is always that we should do every single thing we can do to reduce transmission. And I feel like we're doing a lot, but we're not doing everything. And that mask wearing, I think, is really key at the moment.
Minister, you have it there. The WHO has said we should do everything, and as it stands in Ireland, we're actually not doing very much at the moment in terms of restrictions. You'd accept that?
I recognise we have very high case numbers in our community, but as was mentioned there, we have very clear guidance and advice from the CMO on what people can do around taking personal responsibility around the public health advice. So there's 700,000 people eligible for a booster, and we know from what Paul Reid said today, a significant number of people are presenting to hospital with COVID, who are being treated with COVID in hospital, have not yet received their booster. And it's important to supplement their existing level of vaccination with a booster, and also encouraging those who've gotten no vaccine to get it, because we know that 50% of those in ICU have had no booster, and 35% of patients in hospital who are positive with COVID have had no vaccine, and that's with a huge amount of people, huge percentage of the population vaccinated. There's also
so do you think when Paul Reid said today that we need to turn the tide ASAP, do you think getting those people boosted or vaccinated if they hadn't been vaccinated, that's it? That's the answer?
Well, that's one aspect of it. There's also...
So what are the other aspects?
The other aspects are, so we have a guidance from the CMO on mask wearing, and he's asking people to have a personal risk assessment and to wear masks in the healthcare system and also on our public transport system. That's another aspect of advice, and that's very clear to people.
But I think anybody, Minister, would say if you've been on public transport recently, there's very few people wearing masks. That's just a fact.
That is the public health advice, and that's clear. It's written. Anyone can see it on the HSE website, on the government's website, and it's clearly outlined. Also, there's clear guidance around if people have any symptoms, any cold or flu-like symptoms, they should isolate, they should do an antigen test and remove themselves from the community. So that hasn't changed, and if they test positive for COVID with an antigen test, they should remove themselves from the community for that 7-day period, and that will help break some of the transmission cycle as well.
Christine, the Minister is saying the messaging is actually quite clear to people. Would you agree?
No, I don't agree. And I think one of the biggest things that's happened in the last few weeks was when the mask mandate was dropped, I think what the public heard was the need for a mask has gone. And I think the need always remained to wear a mask, because COVID was at 8,000 to 10,000 cases a day at the time where we dropped our mask mandate. I think at the moment we need to update our public health advice, and I think the message needs to be clearer to people that at the moment we are experiencing a surge because of this new subvariant, and therefore we need to advise people that not just on public transport but in all settings people should wear them. One of the things that's shocked me the most, I think, in the last couple of weeks is the number of older people who aren't wearing masks in indoor settings in supermarkets and shops, and I think, to be fair to them,
but who are probably following the
message that they're hearing, which is the public health advice, is that you don't need to wear your mask anymore. So I think whatever we're looking at the public health advice at the moment, I think it needs to be updated, and it needs to be clearer for people that at the moment there is a greater need for masks than there was a few weeks ago, and that needs to be clear. And to be fair to the public, when we update public health advice, the public do adhere to that, and I think that's what we're looking for, is a very simple message to the public so that people can change their behaviour. At the moment, my view is that if we're not updating that advice, we're not actually doing anything to address the surge.